begin this morning with State Representative Suzanne Harrison. Representative, great to have you on the show. Thanks so much for being here with us this morning.
Thank you for having me, Glenn.
A very important issue. It's something we looked at the state legislature a couple of years ago, but you are running a resolution on school start times. A resolution meaning it's not binding, so what would it do?
Again, yeah, it's not a mandate. It simply asks local districts to have the conversation about healthy kids. Our teenagers are not getting enough sleep, and every year there's more and more medical evidence showing that this chronic lack of sleep is really hurting their health, their academic performance, and even increasing their risk of suicide and car accidents.
So let's dig into this a little more. Our kids go to Corner Canyon. They start at 7:30 a.m. What are we looking at that you would like to see?
I would like to see local districts have that conversation about the pros and cons. Obviously, any change in a system is difficult, and it would involve systems working together to find solutions for transportation and adjustments for extracurricular activities. But those districts that have made those changes, and something as simple as swapping the start time for elementary and high school students to let our high schoolers get a little bit more sleep, they are seeing real benefits in terms of grades and less absences and improved mental health and less substance abuse. And this really matches their biology. Anyone who's ever tried to wake up a teenager in the morning knows it's nearly impossible. It's not that they're lazy, it's their biology is different than adults, and they have a shift in their circadian rhythm to really, they're programmed to fall asleep later and wake up later.
A couple of interesting points there. One, swapping elementary school and high school. So what studies have shown you is that elementary school students are better off getting an early start than high school students. That's interesting.
And certainly that's just one option that districts could look at. I'm not interested in mandating what the solution is. I'm asking local districts to look at the research, look at the pros and cons of shifting school start times, even just a little bit, can have a huge impact on the amount of sleep our kids are getting. And there's some studies to back this up that the kids are actually getting more sleep when the school start time shifts.
One other point I want to bring up, when you get into the real world as adults, those things are still there. Life starts early, we're stressed out, we're sleep deprived, but you say it's all about healthy brain development at that age, and that's what this is about.
Exactly. And I think sometimes we have in our culture, this is a character building, get up and early and get at them, and that works for adults. But teenagers are in a unique phase of their development and their biology, and their development is different in that their sleep schedule and priorities and needs are different than adults or young children.
Any concern at all of that carrying over, though? Once you get out of high school and then all of a sudden, wanting the world to wait for you to get started. Any concern there?
Well, and I certainly think we all, make that spectrum of growing up into adults, and sometimes it seems to shift later and later, but certainly by early 20s that an adult has fully developed brain, and the sleep requirements are a little bit different.
Okay, sounds good. Let's move on to another important issue that you are working on, and that is affordable and quality childcare. Talk about the need, because that's a really crucial element for families, especially those that are struggling to get by in Utah.
This is a huge problem for so many families, especially those middle income families that they need to be able to work outside the home to pay the rent and pay the bills. We live in one of the most unaffordable areas for childcare in terms of access to childcare, and many of our counties have not even a single licensed childcare provider in the whole county. And this is a challenge for families that need to find quality childcare for their kids while they go to work or engage with educational opportunities. The bill I'm working on is simply an employer tax credit. So employers that choose to subsidize care for employees or offer care on site for employees during work hours can apply to get a portion of that investment back in the form of a tax credit to hopefully improve and increase the number of childcare spots available in Utah and help with the affordability issue to help families be able to afford that care.
So that would be targeted at the private sector?
Correct.
Not the state, okay.
Correct.
I hear so many people tell me, we take a look at this and you start to add up what childcare costs, and it's almost not even worth working because that's how much money it's taking out. And obviously that could potentially have impact on the workforce and our economy as well.
Exactly. This is a workforce development issue. We have one of the tightest job markets in the country. Every employer I talk to cannot find qualified, skilled workforce. And if we can do something to help those workers overcome some of these barriers to entering the workforce and making sure their kids are taken care of in the meantime, it could really help with our employee shortage.
You are a physician, a doctor, so I really would like your perspective on this, and it's something you're working on as well. Reducing healthcare costs, sky high, out of control. How do you go about doing that?
It's a huge problem, and I hear from patients, my patients every day, that they can't afford to see the doctor or certainly can't afford the medications that they're taking. And one area I'm really focused on is prescription drugs and how do we reduce the costs for families for that. I'm working on legislation to encourage our federal government to unshackle ourselves. We are one of the only countries in the world that prohibits our government from negotiating with drug manufacturers to demand lower prices. And for Medicare especially, that is ludicrous that we are handcuffing ourselves and paying the highest drug prices in the world because we're not negotiating for cheaper prices. This resolution encourages the federal government to do something about it to help seniors, and also it will help taxpayers in the form of cheaper medications.
A conversation we have every year, and we always talk about the need, but we don't really see the needle moving a lot. So how can you actually put that into action, especially with the resolution?
Yeah. Well, that resolution is for the federal level, but I'm also working on a legislation here at the state level that increases the purchasing power and allows the public employees health plan to pool their purchasing power with the public employees health plans of other states to increase the numbers, so to speak, and leverage for cheaper prices and negotiate for cheaper prices for medications. That again will help taxpayers because we're ultimately paying those costs for public employee health plans. And anytime there's leverage down in terms of prices, that can ripple out and hopefully decrease prices for everyone.
Okay, we have about a minute left. Another important thing that you've been working on, I assume this is again with your connection of being a physician, is our air quality. Tier 3 gas is one thing that's coming along, but you are taking some other steps this year as well.
Absolutely. This is something that everyone cares about, and it impacts our health and threatens our economic future if we don't address our air quality. One project I'm working on is to identify where consumers can purchase that cleaner burning, lower sulfur Tier 3 gasoline that can drastically reduce polluting emissions from our cars.
I just saw you about a week ago at the new Speedway that was opening up, and we saw those locations pop up throughout the state.
Absolutely. So not all of our refineries have chosen to make this cleaner burning gasoline, and I think this is an opportunity for consumers to use our purchasing power to clean up the air by choosing to buy gasoline from those gas stations that are choosing to buy that cleaner burning gasoline. It will cost about the same, and I'm working to put together a list to allow for consumers to know where that is. And I'm working on a bill file also to allow for a sales tax credit, a sales tax break for people that are going to step up and buy affordably priced electric vehicles and plug-in electric hybrids or lease them.
Okay, I know my understanding is on the Tier 3 gasoline, if it's a Tier 3 car, it'll burn 80% cleaner, but even if it's not, if it's an older vehicle, it's still like 15% cleaner. And everyone doing that, I mean, that starts to add up.
It can make a huge difference. If you're not already driving an electric vehicle or using transit every day, this is something simple you can do to dramatically reduce our particulate pollution and clean up our air.
Okay, Representative, great to have you on the show. Thanks so much for being here, and we will follow these bills as the session plays out.
Thank you for having me.
You bet.